A lot of good stories coming your way, but our top story tonight, a disturbing shift is emerging in our healthcare system. Time Warner and IBM, two very big companies, are pushing their retirees from company-run health plans onto private insurance exchanges. These two big employers are joining the ranks of other large companies doing the same thing in an effort to cut costs. With more on this, Avik Roy, a senior fellow at the Manhattan Institute. Avik, thanks for coming on the show. We were talking about this before we started. You know, I've seen this going on for a long time, frankly. Companies saying, no, we can't really afford health care for retirees. Now hundreds of thousands of people are going to be on these private exchanges. Fully 44% of employers say they will move retirees to private exchanges. And you say Obamacare made this almost inevitable. Why?
Almost inevitable because there was a tax break for employers to offer prescription drug benefit for retirees when the Medicare Modernization Act passed in 2003, because the government at the time was worried that employers would dump their retirees onto Medicare. But now Obamacare, in order to raise all the revenue to expand coverage, eliminated that tax break. And so now employers have the incentive to dump all these workers onto Medicare because that's more tax efficient.
Terrific. So more burden for taxpayers out there. It'll be more expensive for us. And I got to ask you, is this the beginning of the end of employer-sponsored benefits for that age group?
I think so, because if you're an employer, when you know these people can be on Medicare, it's not like you're throwing them onto the street, and you can help supplement their Medicare coverage through these exchanges, these private exchanges. That seems to be the way to go. If I were running a big business, that's what I would do. It's perfectly rational.
Perfectly rational behavior. A lot of retirees are very upset, and yet some folks say that the ride they get on the private exchanges may be good. What do you say?
Yeah, I think it's going to be actually a better system. In general, when it comes to health care, one of the things that we need to do more of, and exchanges help drive that, is to have seniors and Americans generally control more of their own health dollars. If you control more of your own health dollars, you're shopping for coverage yourself, you're shopping for the benefits yourself, you're shopping for the procedures and the services yourself, you're going to bring down costs because you're the better steward of your own money.
I know it all sounds good from an economic point of view, but when it gets to you and me having to do all this homework, roll up our shirt sleeves, it's not a pleasant prospect.
We do it when we buy cars, we do it when we buy computers, we do it when we buy our cell phone contracts. I think people can handle it.
Well, I have a lot of confidence in our viewers, but I know it's a pain in the butt, and it can be very difficult, especially if you're locked into a provider that you really, really like. What's interesting about this, of course, is that a lot of private sector companies are finding opportunity in this. Extend Health is one company that's seeing a virtual boom in business because of this. Talk to me about the private sector opportunity here. Yeah,
so as you said, it's a huge boom. More and more large companies are turning to private companies that will set up these exchanges. These are not like Obamacare's publicly subsidized exchanges, but these are entirely privately constructed exchanges, so that instead of an employer offering one insurance product, they go to this exchange and the employer offers a set amount of money, say $3,000, $4,000, $5,000, whatever it is, for that employee to then shop for coverage on these private exchanges. So Extend Health is one of the big companies that's doing this. They were bought by Towers Watson, which is a big human resources, publicly traded company, because they saw this
vertically integrated here. It's interesting that kinds of what's fueling this growth and who's taking advantage of it. Just to show you some numbers here, in 2007, Extend had 3 clients. They now have more than 300. That's a huge ramp up in growth.
It's going to grow even more, I think.
I think you're right. Well, when you look at the numbers of companies, and I mean big companies dropping health care for retirees, it's Time Warner we mentioned. We mentioned a lot of companies here, IBM, you name it, but also Caterpillar, Sears, DuPont, Darden Restaurants, the list goes on and on. Is this a precursor of what could be happening for employees, people who are currently not working, not retirees?
Absolutely. I mean, I think you're going to see more and more effort for companies to go to defined contribution rather than defined benefit. Just like with pensions, you don't just give someone a pension, you give them the dollars and then they invest in a 401k.
You give them some of the dollars.
Some of the dollars, right? But it's the same idea with health care. Give them the dollars, and that way you can budget. You can say, I'm going to give my employees $3,000, grow that with inflation, as opposed to having to say, we're going to give you a health benefit, whatever it costs, we're going to pick up the tab. That's a much less stable situation for companies.
So not unlimited, and frankly, we've been moving towards this for a long time. Avik, thanks for coming in. It's always great to see you. Thank you.
Same to you.